All right. Well, I like to start each podcast when I have a guest of talking about how we connect. And so we were in a course together that has nothing to do with healthcare or medicine. And I will tell you that what got my attention is that you do some pelvic floor physical therapy. And as a gynecologist, we actually had a physical therapist that specialized in pelvic floor in the town where I live, but they're few and far between. So that's a much needed field. So tell us just a little bit about you and what you do, and then I will tell you what I really want to talk about today.
All right, sure. So excited to be here. So I'm a physical therapist for close to 20 years now, 19 years to be specific. And I have done from, like you said, from orthopedic to pelvic floor to neurologic to pediatric, everything. And then in the last 5 years, my heart was I am an orthopedic clinical specialist. So I know obviously anything bone, muscle, all of that. And I started to get more teaching from pelvic floor. And as I started to gradually add pelvic floor, I realized, wow, there's such a big missing link between orthopedic and pelvic floor, even within the physical therapy profession. So I was treating pelvic floor patients and they would have like an orthopedic problem that was not worked on and vice versa. Like my women orthopedic patients, I would treat them and then I'm like, but they also need pelvic floor, they also need breathing and all of that. And so now what I do is I kind of try to bridge the gap and I take them from that journey of rehab to wellness, where I give them everything for their whole body in my signature program, which is called Trend Shift, where I try to not only physically give them the shift, emotionally and mentally also provide the shift. So yeah, that's kind of like a long story, but that's my journey of I wanted to be so specific on how I understand hormones now than as an orthopedic physical therapist I did.
That is so awesome. And I love that. I do the same thing. I think it's so important to lay the foundation before you start trying to build on it. Because if you don't have a solid foundation, then what you build is not going to stand. And so one of the things that I wanted you to really address today is frozen shoulder. And I'm coming at this at a little bit different angle because and I'm kind of embarrassed to admit this. As a gynecologist, I had no idea that menopause was a risk factor for frozen shoulder. But I'm coming to this more as a patient. I've had frozen shoulders on both sides. I'm very active now. I mean, I had a season in my life where I was very sick and I couldn't. But I had an injury on this shoulder and I got a frozen shoulder and I blamed it on the injury. Then, just out of nowhere, as active as I am, I got a frozen shoulder on this side. And I was just thrown for a loop. It affected me in so many ways. So I'd just like to hear your perspective on that because I watched you do a Facebook Live that talked about frozen shoulder. And I was like, oh, I got to have her come on the podcast.
I love that. And, it's interesting that you said that, kind of piggybacking on my story that I said. 10 years, 12 years ago, when I used to treat frozen shoulder, it was the same thing. Because if you read about it, it says insidious onset. There is no real, till date, they haven't really strictly connected with something, right? And that's what I would tell patients when they would come. And usually they were like later stages of frozen shoulder when things are, we can talk more in detail about it, but things were really tight and painful and limited and their lifestyle was like stuck. I never connected it because there was no research. Nobody talked about menopause and perimenopause and all that stuff. And as again, my pelvic floor training started, I was like, oh wow. And then I just started looking at the same patients with a different lens. To go back, yeah, our hormones are huge, which would play a role, usually closer to menopause. But I will say in the last 5-6 years, I've seen younger women early 40s having frozen shoulder. Compared to back 10 years ago when I was in my 20s, and I would only see close to 50 and plus. So there's definitely that shift has happened. And how everything is like a little early nowadays. And I think this also contributes to it. But then some of the other things could be your hypothyroidism, diabetes, that's a huge one. One thing with diabetes is it does take a little longer to recover. That's like kind of like from the get-go, I always try to encourage patients not to lose motivation. They are going to get there, but it does take longer. And some of like other condition more neurologic is like stroke, Parkinson's, where people are just moving, right? But when we talk about frozen shoulder, like it's such an easy definition by itself, like frozen shoulder. But more like a clinical diagnosis is adhesive capsulitis. And anything I did, you know, and probably some of the listeners know, is inflammation of the shoulder capsule. So it's kind of the same thing. And adhesive is more like adhesion. There's like a lot of fibrous tissue and there's no movement happening. And so what people don't know is there's like these big 3 stages of frozen shoulder. And you don't know as a clinician or a provider where you're going to meet the patient. The earlier the intervention, the better the process. And that's with anything, right? But a lot of time what happens is we just take, because the first stage is painful stage. It's really not movement restriction. And people just take NSAIDs, people take anti-inflammatories, and they're thinking it's going to get better. Doctors who are not educated, they're just prescribing pain medication, not connecting the dots. And by that, I mean, anywhere from that 4-month to 6-month mark, you've reached the stiffness phase. And that's when people come to me, where they're like, oh my God, I can't move my bra. I can't put my wallet in the pant, depending on I can't put the seat belt on. All of those little functions is when they think of therapy. I can go into as detail. I mean, I'm fascinated by the topic. Do I love treating patients? Yeah, I don't go too geeky about it.
Well, I think the thing that I found so interesting and the reason that I wanted to get any treatment is I was playing golf and I could move my arm this way. But if I reached to get, like if something was under the bed or whatever, and I was going to reach this way, or like you said, to undo my bra, I couldn't do this at all. So there were only a couple of movements that I was restricted with in the beginning. And so what should I have done at that stage before that?
And it's interesting you say that. I always joke, only a plumber would know, right? They do like or electricians who go kind of like end range motion and awkward motion. The thing is, it is very specific, you're right, because it's a capsular movement. It's how your capsule, your joint capsules, it's restricted in what we call external rotation. So if it's on video for people looking at this, the motion, or what's a daily movement would be if you're playing tennis, right? So that's kind of like when your arm is up. The second one would be kind of like trying to bring your arm sideways and not so reaching sideways, and that's where the seatbelt kind of comes a little bit. And then it's internal rotation, which is hooking up your bra. So the tightness happens in a capsular pattern, and that's when years back, right, early 1900s, when they were like, oh, this very common specific pattern. It's not just shoulder pain. It's not your muscles. It's not their tendon. It's something more specific. And that's kind of where that diagnosis happened that, okay, this is very pericapsular. It's inside, but at the same time, the pain is on the outside. So you're right. What you could have done, really being active is the only thing which you already did. I don't think you can prevent. I don't think you can predict if you're going to get it. I will say people are aware about therapy options and doctors are more aware of that. I rarely get a real frozen shoulder anymore. So we're at the end of 2025. I've seen one real frozen shoulder, but I've seen, 50 plus shoulder, kind of frozen shoulder baby. But I saw them so early in stage that we were able to gain 100% of movement. They never went through the whole stage, because they caught it very soon. So if we just diagnose it as shoulder stiffness. I don't even use frozen shoulder unless you're talking about influent, billing, and unrest.
So I think that's important for my listeners to hear, is to use that end of range of motion. Because again, I was playing golf and it didn't affect movement and discipline at all. It was very specific planes. And I know when I went to fitness class, all the other women do this. And for anybody that's just listening to him, and I couldn't do that at all. And I think that using the end of range of motion is super important for people. And you have to be intentional about that.
It's the thing. So, something that is very powerful. When I did not know about the hormonal connection But I knew how frozen shoulder happens. And, obviously being a therapist, but I had a patient who would say she was a teacher. And I remember her saying, I was just pulling the windows up and that did it to me. But yes, it can, but it would do more muscles, right? Rotator cuff would be something which the presentation should be, not your capsule, not your specific external rotation, abduction, like the movement that is specifically limited. And I could never convince to the end that it was not because of the injury. But what must have happened when she did it, she realized she couldn't do it because she may have done with the same force she would typically do. She felt pain. And then she blamed the window opening moment, but really not the window opening moment. And that with everybody.
I think so. And that's why, for my right shoulder, I had injured it. And I'm like, oh, that's why I had it. But in retrospect, I don't think it was, because it was months after the injury that happened. And yeah, it probably did a little bit of damage, but the other one just came out of the blue. And I do think it's interesting that you mentioned inflammation and diabetes. And with lifestyle medicine, I always like to incorporate diet and making sure that people are avoiding sugar that is so highly inflammatory and getting enough fiber that helps with gut microbiome, that helps regulate inflammation. I don't know if there's any research linking those two, but I think inflammation in general is something that does a lot of damage to our bodies, joints, capsules, muscles, everything.
Yeah. So the answer is yes for inflammation. Interestingly, it's even though it is chronic synovial inflammation, like it's inflammation of your joint, the presentation is more kind of fibrous, kind of like just the stiffness part, right? So we say freezing, frozen, thawing. That's really the stages. There's 3 stages of it. And freezing is when it's starting to freeze and all you will feel is pain. You just have this intense pain doing things. You're able to do it. As you go to frozen, inside your capsule, those changes are happening already. All that is inflammation, but really it's more the adhesion formation. That is really what is going on, right? And that's when pain and stiffness kind of play together. And then the last stage is thawing, where really it's kind of like the end of it. They're kind of like trying to exit your body. So I'm like you, any of those things happen, including a lumbar disc herniation, like a back pain, I will tell anti-inflammatory naturally as much as you can take, right? Rather than just like steroid, where again, if you cannot walk out of the bed and the doctor gives you, I get it. But usually most of us can do things. Usually I get questions about turmeric. That's what I
Well, I think that what you're doing in general is so important. And that's just encouraging people in general, but women specifically after age 40, to be intentional with. And, so many of us sit at a computer all day, every day. And so just tell my audience a little bit about what you do in the social media world and with your courses and everything to help women stay active so that they avoid things like that.
Thank you for asking that. It's like my passion project, but now I'm like so involved and so amazed by how women are doing. Just so grateful for what I can and I'm able to do. So the problem is, like I said, it's called friendship. And really my goal is that every woman should be strong enough without hesitation to move. Doesn't matter what. Doesn't matter it's your energy level, injury level, pain level, to avoid all the issues that can happen later in life, like osteoporosis, or muscle mass. Because those factors are important to live life in your 80s and 90s. It gets hard to get out of the bed and move the blanket and get out of the toilet, get out of the car when you're 90 years old. We don't even think about it in our 40s and 50s and 60s. And suddenly it catches up on us in these little movement effects. So my program is, I do very functional targeted movement. It's small group classes where I meet every week and we do exercises very targeted on big movement, but start slow, start small. Everybody is different. And all I talk about form alignment, what's the right way to cue your body, how should you even if you're doing a normal exercise. Because if I have too much weight, I can hurt my neck or at least feel discomfort, right? And that's kind of how the whole program is about. And it's an amazing space. There's a lot of support, which women absolutely love. And by end of 8 weeks, they've not stopped. Any of the women who've been in the program, they've never stopped exercising after that.
That is impressive. That's really impressive. And I have to tell you just a personal story. My mother was in her 80s, and she moved to assisted living in February. And so many of the people in assisted living are very frail. They're walkers, they're in wheelchairs, they're in their 80s. And my mother walks the halls like all day. And when she can get a ride, she goes to the real gym. And I had to go down there this morning to help her with something. And they were starting a class in the gym. They're in assisted living. And she going in there, it's just a baby class. They just do their arms like this. I said, well, I actually went in there with her. And sure enough, they were just doing beginner chair, senior citizen movement. And so I said to the lady, I said, my mom is waiting on an advanced class. And she kind of did a double take, and she goes, an advanced class? And I go, yes, my mother can hold a squat and she can hold a plank. I thought that it's because she went to the gym regularly. And I don't know what age she started going. My grandmother actually bought her a gym membership years and years ago. But for many, many years, my mother has gone to the gym regularly. And now she's in her 80s and she is extremely fit. And so that's my goal. I see those women who are in walkers and in wheelchairs. I'm like, no, I want to be like my mom. I want to be walking the hall.
I know. I'm just amazed. I am treating right now someone who is 101-year-old.
Wow.
When I walk every day, I'm like, if I have this lady at the end of my life, I mean, she walks, she talks, then she has a little memory and cognitive issues, which is very normal for her age. And there are times she will say, I don't want to walk today. And I'm like, that's fine. She walks every other day, every day, and she lives in her home with her daughter. And I am just super impressed by that what being active can do to you. And I feel like every woman deserves that. But we are like pushing this stage of life. There's such a sandwich generation between the kids and the parents. We, try to keep ourselves going with our kitchen and office job or whatever. Somehow we think we don't have time for this. And that's where I want to be like, it's kind of like if you have someone waiting for you, you're going to show up. Every time I'll have people say, I just didn't want to just come today, but I knew you were sitting on the other side waiting for shooter for me. And that has changed your lives.
That is so true for me. So the fitness center that I go to, you have to reserve your spot. And that has been the key to success for me because I've got a slot reserved, and we do like boot camp. So it's in stations, and they'll set up for the number of people that are coming. And I know that if I sign up and don't show up, that affects someone besides just me. And I think that is really key when it comes to staying fit. I think that is
so right. I just received an email from one of my clients yesterday, and I was asking everybody there why, because it's just amazing to know how they started this, because my ideal client would be someone who was injured in the past or had a bad personal trainer experience, and they just don't feel right because they have that little pain in the back, in the knee, somewhere where they don't think they can do big, good stuff, and I'm not about jumping around and a lot of cardio, because you don't need that when you're 80 and 90 again. You don't need that for building muscles and bones. So I've struggled with shorter exercises. But anyway, she was telling me how she's been watching me for a while and she wanted to join my program. And something happened to her back. And when she came back after the back recovery, she's like, I'm joining this. She's been very happy, and I'm very happy that I was able to give her what she was looking, quote unquote. I think we all beat our why. I mean, they're just with anything again in life. We cannot go ahead. It's boring to push ourselves to go to exercise every day for everybody.
Yeah, and I think that's what a lot of people miss, why they start things and don't finish them. And I teach that in my courses as well. But tell our listeners where they can find you and where they can sign up to follow you.
Yeah, I'm on Instagram, Dr. Preeti, Dr. Preeti, Preeti, DPT. That's Doctor of Physical Therapy. So DRPREETI DPT. That's a mouthful.
I'll put a link in the show notes.
Okay, Dr. Preeti DPT. And then I'm on LinkedIn. My first name and last name, Preeti Jha. I'm very active. And I have a small Facebook community where I try to motivate women who are there just to get them going, just to see that it's possible. And it could be something simple, but something they might have not done. So that's like the few places but if you go online, you'll see me everywhere, basically.
I'll put the link in my show notes. And thank you so much for taking time to talk to me today. This has been fantastic.
You're so much, Vicky.
The information contained in this podcast is for educational purposes only and is not considered to be a substitute for medical advice. You should continue to follow up with your physician or healthcare provider and take medication as prescribed. Though the information in this podcast is evidence-based, new research may develop and recommendations may change.